All right, we're going to go ahead and get started here. Welcome, everyone. My name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. You may notice if you've watched earlier streams that I'm in a different part of the house today. We have roofers working on the house, so I apologize if you hear some background noise, some pounding. We'll just have to work through it as we go today, but welcome to the stream. We are just going to go through some kind of basic updates and just do a rundown of some of the metrics that we're taking a look at most recently. If you have questions that you want to ask, you're always welcome to put them in the comment section of the video here. And if you're watching the recording of the video, you are more than welcome to send your questions to us via social media, and we'll try to get back to you as soon as we can and maybe answer those questions on a future stream. So with that, I wanted to kind of give a status update on where we're at in terms of our COVID-19 metrics, case activity, and where we are today and where we have come from, and compared to earlier in the pandemic, what some of the numbers have looked like. So I wanted to just kind of guide you through how to find some of this data on our website. If you are new to the website here, this is what you land on when you type in co.rock.wi.us/public health. So this is the public health homepage. And you can click on the coronavirus icon there. The picture of the virus itself will bring you to our COVID-19 page. We have our current mask guidance right front and center there. And as you scroll down the page, you'll see some icons start to show up. And we have data here. So you'll click the data icon. And this brings you to a variety of reports. And if you've watched some of these streams previously, you'll find this very familiar. But for anyone who's new and is watching this video, this is where all of our data reports are included. And additionally, a link where you can send us information if you feel that there's an error in one of the reports. You can send us this information, fill out the form, and we'll try to address those issues as they come up. So what I wanted to show you today is a report that's updated every weekday. And this includes a lot of information in terms of total cases. And one of the new pieces of information that we've added to this report is the CDC metric of the number of new cases per 100,000 people over the past 7 days. So if you're aware of kind of the metric guidance from the CDC has put out new thresholds, and I guess they're not new at this point, but they've been out for about a month now. And this helps us kind of understand our case activity with respect to the population size of Rock County. So the highest threshold they have is 100 cases per 100,000. So anything above that is deemed as high transmission in the community. So we have 163 new cases per 100,000 in the last 7 days. This metric has come down a little bit, so we're starting to see a little bit of a decrease in terms of case transmission, which is good news. We're still well above kind of that high community transmission for Rock County. So unfortunately, we still have high numbers of cases, but we're starting to see a little bit of a downturn in terms of the rate of increase. So that is kind of good news. You know, we're still high, but the numbers aren't continuing to increase, which is always good news. We don't want to see drastic increases like we've seen earlier in the pandemic. Based on the information that we have about 592 active cases in the community. And this number has come down a little bit. Earlier in the week, it was at 618 as a high for this week for the number of active cases. So more people are recovering than are being deemed as new cases, according to the most recent data that we have. So that's some good news. We were kind of very low, so under 100 active cases in the summer months. So just a few months ago, we were under 100 active cases. So unfortunately, we've kind of climbed steadily since those summer months, and hopefully as people are starting to wear their masks and social distance again and get vaccinated to higher and higher levels, we'll see that number come down. So I'm going to skip down in the report a little bit. And I wanted to give you a sense of the number of patients who are currently being hospitalized for COVID-19. You can see this graph on the bottom of this page. The green line correlates with the number of hospitalized patients on a daily basis. So we get reports from our healthcare partners on Thursdays and Tuesdays. And so we'll update this data on Tuesdays and Thursdays with the number of count of inpatient COVID-19 patients for each of those weekdays. And so you can see most recently, the data was updated yesterday. And so we had 21 patients in our hospitals getting care for COVID-19 in Rock County. And that number is a little bit high. You can see that recently, the most recent high was 26 patients getting care on August 23rd. That number has come down a little bit at the end of the month in August, and then it came back up over the Labor Day weekend. We saw a few more patients needing to be hospitalized for COVID-19 illness. Relatively speaking, 20 to 25 patients in the hospital is not as high as what we had seen even kind of in mid-May or mid-April to mid-May. So we saw a high of 26 there. So we're seeing consistent numbers of hospitalized patients in that time period, and definitely lower than what we saw kind of between starting in the end of September last year and kind of stretching until almost February or early March, where we were starting to see finally some decrease in our hospitalized patient numbers. But at this time in September last year, we had about 10 patients in the hospital getting care for COVID-19. So we're in a little bit different spot right now with respect to the number of patients who are needing care, who are falling severely ill for COVID-19. So just to give you some kind of perspective, we're a little bit higher than where we were at this time last year. And when we look at our case activity, and we talk about our active case numbers, we're about just under 600 active cases as of yesterday. And if we look at case activity in early September, we were at just under 300 active cases in early September last year in 2020. So definitely seeing higher numbers of case activity more recently compared to last year at this time. And the hope is that as more and more people get vaccinated, we won't get into kind of the amount of case spread that we were seeing in October through kind of January and February, where we were seeing very high numbers of active cases and things like that. The good news is that we are seeing the effectiveness of the vaccine. So that's what I wanted to show next, is just kind of the data that we're seeing in terms of the effects of the vaccine. So I'm going to view this in full page mode. So when we look at the number of cases that are considered breakthrough cases, these are cases among people who have been fully vaccinated. So this is those who have been vaccinated and it's been 14 days since their final dose of the vaccine in the series. Anyone who tests positive after that 14-day window is considered a breakthrough case. And when we look at our data, there's about 83,500 Rock County residents who have completed the vaccine series and are fully vaccinated. And there have been about 350 breakthrough cases so far to date. And so when we compare that number to the total number of those who are fully vaccinated, is about 0.42% of that population. On the other side, if we look at those who are unvaccinated, people who haven't received any dose of the vaccine, we have about 79,500 individuals in Rock County who have not been vaccinated yet. And there have been 21.7% of those individuals who have fallen ill with COVID-19. So when we make that comparison, you can see that those who are fully vaccinated are much more protected from contracting the illness compared to those who are not vaccinated. When we look at those who are hospitalized, based on those breakthrough cases, there have been about 23 people who have been hospitalized who are fully vaccinated and are those breakthrough cases. And then among those who are unvaccinated, there have been about just over 1,000 cases. So 1,025 hospitalizations have occurred among those who have not yet completed the vaccine series. So again, when we make the comparison, it's about 0.02% of those who are fully vaccinated who have needed to be hospitalized, and 1.2% of those who are not yet fully vaccinated who have needed to be hospitalized. So again, you can see the pretty stark comparison and the difference between these groups and the protection that the vaccine imparts. And just slightly different kind of look at this data, but the death rates. So normally what we do is we take a look at those who have died based on the population size. So of those who are fully vaccinated, there have been 3.6 deaths per 100,000 fully vaccinated individuals in Rock County. And by comparison, there have been 241.5 deaths per 100,000 people who have not completed that vaccine series. So when we take a look at the effects of the vaccine, we're seeing strong indications that it's effective at reducing the spread of the virus, and it's also keeping people out of the hospital and preventing severe illness. So one other piece of data that I wanted to share on the stream today was looking at some of the demographic trends. So overall, we have kind of a breakdown of the demographic trends in terms of age, gender, race and ethnicity, and in terms of the percent of cases that are occurring in these different age groups and things like that. And so over the course of the pandemic, there's been about 9% of our cases that have been among children under 15. But more recently, we're seeing a shift where there are a higher number of cases among this age group. So this is in part due to the vaccination, and there's high uptake of the vaccine in those older age groups. Kind of the 65 plus age group in particular has a very high level of coverage from the vaccine, and lower obviously in those among the age groups who are under 15, because kids who are 11 and younger are not eligible yet to receive the vaccine. So we're seeing a shift, and most recently in the last 2-week period, I think 15% of the cases were among those who are ages 0 to 11. And earlier in the pandemic, we had seen levels that really never got above 10%. So we're starting to see a little bit more in terms of higher percentage or burden of cases among the younger age groups. We're seeing our second highest age group is between 20 and 29 in terms of the burden of case activity. And so when we're looking at the demographic trends and the shift in case activity, we're starting to notice that there are some shifts in terms of case activity among the younger population. Thankfully, however, we're not seeing severe illness in that younger population. So when we talk to our healthcare providers and health systems and thinking about pediatric hospitalizations, they report that there hasn't been an increase in those pediatric cases who have been hospitalized due to COVID-19. So overall, the data is still favorable. You know, although we're seeing higher case burden in these younger age groups, we're not seeing severe illness. And looking at the average number of kind of patients and the average ages of the patients who needed to be hospitalized. So for example, in August, there were 51 cases or patients who needed to be hospitalized for COVID-19, and the average age of these patients is 56.5. When we looked at the same numbers of hospitalized patients in August of 2020, the average age was 59. So not a huge swing in terms of you know, a lot more younger individuals needing to be hospitalized, but a slight shift in terms of younger people being hospitalized. Right now, just to reiterate, we have not seen an increase in pediatric hospitalizations, but we are seeing some increase in terms of our case activity in those younger age groups. So as always, it's very important for people to get their vaccine. If you have any questions, I'll just show you the website you can go to. So rockcountyshot.com is a great website that provides information on getting the COVID-19 vaccine. You can see how much it costs and where you can go to get the vaccine in a location that would be suitable to you. There are several locations in the community, not just your pharmacies and healthcare providers, but also there are a number of community-based clinics that offer the vaccine, and it's at no cost to you. So, you know, if you have questions about getting vaccinated or the safety or effectiveness of the vaccine, I encourage you to talk to your healthcare provider and get more information from your doctor. So that's all I wanted to share for today. Again, I'll just put up our Rock County Public Health COVID-19 website. You can see the link there. I'll actually back it up a couple so you can see the URL to get to our public health website. So that's right up at the top there. But for now, that's all the information I wanted to share for today's video. I'm just going to check the chat here and see if there are any questions that have come through. All right, looks like there haven't been any questions that have come through. As always, if you do have questions after watching the video, you can send those to us via social media. And with that, I'm going to end the stream here and hope everyone has a nice weekend and enjoys the nice weather. And we'll see you in a couple weeks.